Community-based research matters because it makes for better scholarship and it changes people's lives. It's as simple as that. One thing I love about Notre Dame, which I think sets it apart from a lot of other universities, is the institutions as well as the students' commitment to social justice. And for me, doing community-based work is a concrete manifestation of those ideals of helping others, of wanting to give back to others.
The first time that I met Dan Lende was a very exciting time because he was new to campus, and I found out that he had a background in HIV and substance abuse research. It means absolutely everything to have an individual who is so dedicated to community-based research.
My main community-based course is Anthropology 45820, Research and Disease, Methods in Medical Anthropology. And this is a course that aims to accomplish two things. One is to teach students ethnographic methods with some quantitative methods as well, and to have community-based research as a main component.
Well, Professor Lende started off by giving us each a topic, and my group got AIDS, the new face of AIDS, and he said, run with it. Find out who the new face of AIDS is and make a difference.
That's another way that he is very good, because when the students come, they are ready, they are prepared, they are eager to get involved.
The main point of our research was to listen to women and listen to the concerns they have in the HIV community and see what we could do for them. And so we thought, well, if we could start a support group, that would be amazing, because they could tell each other their stories, and it's a wonderful thing, it's a beautiful thing to see them working together through these struggles. And it's a wonderful thing to think that I had something to do with it.
This last semester, fall 2008, we worked with Memorial Hospital with African American Women in Touch, looking at waiting room design and how they could better redesign their waiting room to satisfy patient needs.
Well, you know what I always wondered? Does the waiting room in our breast cancer center meet our needs or the client's needs? And I said, I just want to know, is there something that we could do that would make things better for the client?
Before taking this course, I never thought about how the waiting room could really affect patient experience, particularly in a breast care center where women are very nervous about what will happen, and that sense of uncertainty really.
To have people that have not been a cancer survivor to be so interested. And that's what impressed me, and I have to keep going back to Daniel and the students. These were not cancer survivors. In fact, I would laugh with the student. Probably most of them hadn't even had a serious cold.
The students were so excited about what they did in the semester that they decided to produce this beautiful book for Memorial Hospital, which really provided a guide in the stories of these women, how they used humor to overcome a lot of the health concerns and the impact of chemotherapy, which really changes women's lives and often leaves them feeling pretty bad about themselves, and humor was a great way for them to overcome that.
I thought it was wonderful to do research where you were actually impacting the people who you were working with the entire time.
Meg Tao, I think, is a very clear example. I mean, she was in the original community-based learning class that I taught here, and she's been able to take things that she learned from working in my class in terms of gaining a ground understanding how to do this sort of work, both in terms of getting good data, but also asking the right questions from the outset. And they've asked her to teach on this at her master's program and to teach about this in some of the places she's been.
My larger project was part of my senior thesis, where I obtained a Europe grant and spent the summer in Lesotho in southern Africa. I did research with a local NGO called Touching Tiny Lives, which is involved in delivering HIV/AIDS interventions to children and families.
And so I know that she takes this as very seriously, and that it's helped her to realize that you can be both a good anthropologist and a good public health person.
I anticipate having a career in action research and evaluation with community health projects, and I can definitely say that My CBR experiences at Notre Dame have been a really large part of this trajectory.
For me, last semester, the project with the PTSD vets was tremendously inspiring.
What he did was sent me 5 students, and they came to my PTSD groups with these guys who are warriors from World War II veterans, Vietnam veterans, Iraq, Afghanistan vets.
They shared their lives together, and they realized they had common ground, and that became a project that they worked on together that's helped them, the vets locally, but also started to reach out and change the students' lives. They talked with such passion about what they did.
And they all got back together again after meeting with me and wrote a wonderful report that has just been really one of our cornerstone documents. And what I hear at this point is that report that's been posted on the web has already had 1,500 hits. They legitimized us. They made us public. They documented what we were doing. They documented the pain and suffering of these guys as individuals, not just for our community, but for anybody that wants to look. And it was it had Notre Dame behind it. It had all of what Notre Dame represents behind it, in the sense that these students that represented Notre Dame cared about our guys, cared about their stories, and cared about making their stories something that helped our country. They cared about our heroes.
Community-based research is not the kind of thing that gets you tenure, that gets you published, that gets you the accolades all the time. And so, again, it's another level of just real, sincere, humane commitment.
For me personally, it's tremendously rewarding to work with community partners, to see how much it means to them to engage with students, to see this group learning that takes place well beyond what I can offer in a class.
And so again, it gives another credible face to saying that yes, these are relevant issues, health concerns in our lives, in our communities, and our families. And so, yes, it's great to have a partner who is willing to stand up and help us address those kinds of things.